Okay.
There really are four things every American should do. One is not smoke. One is get their body mass index down to around 25. Now, it doesn't have to be 25. It could be 27, 27 and a half. If you don't know what body mass index is, go on Google and search it, and it'll give you a formula. Put in your height and weight, and it'll tell you what it is. One is eating at least 5 fruits and vegetables a day, and that is really important. And then last is trying to exercise at least 150 minutes a week. And that's vigorous exercise, walking fast, something like that. If you can do those four things, it's been shown to lower your risk of dying, having a heart attack, having a stroke by 40% in just 4 years. Now, you may say that's not much, but let's compare that to something else. Let's compare that to stents. Stents don't lower your chance of that at all, those things at all, in a stable, chronically stable patient. Bypass, it's about half that good, even if you have a lot of narrowing of your arteries. What about the drugs we take, Lipitor, Zocor? That's maybe a third or a quarter as good. So these lifestyle things are incredibly important, and only 3% of Americans do these four things. And that's the sad part, because these are not things that are toxic. These are not things that are going to hurt your liver, not things that are going to cost you a lot of money. In fact, they'll probably save you money. Yeah, it's a couple of groups. One is the family history. I think we're all paying more attention now to family history. And that people knew that their father had a heart attack at age 48, and they're now 46, and they're starting to get concerned about it. It is people that have had problems, and we're seeing early and earlier patients present with heart attacks and strokes. We've got a patient on the hospital service now that's age 21. That's too young, and they're starting to say, gee, it may not have been in their family, but it may have been a coworker or somebody like that, and says, gosh, if Fred or Mary had this thing, am I at risk? And they're coming in for that. And the third group is people we're seeing that have known disease, that are doing everything they can in terms of getting bypassed, getting medicines, but they're still having trouble. And they're coming in saying, what else do I need to do? And it's kind of funny because now we're kind of going back to what's the basics and say, what are the basic things you need to do? Exercise, eat right. All the things your mother told you that we never really had quantified. And some of these studies really are just in the last year and a half that have shown us how effective. In fact, this one study of the four things was a 16,000 patient study. They brought 16,000 patients in and said, do these four things: eat right, don't smoke, exercise, and lose weight. And that just came out in the last year and a half. Because when I was an interventionalist, patients would come in with an acute heart attack. They'd be in asystole, their heart wouldn't beat. They had a total occlusion of their front left artery, and their mortality could be as high as 25–30%. But with intervention, a stent, a balloon, you could have a 92% chance of treating them, getting out of the hospital 4 or 5 days later, walking out vertically. Success. So that was a pretty good success rate, very satisfying. Prevention's a little different. People come in, they're not eating right, they're not exercising, they're stressed, they're not taking care of themselves. The national average to get someone to change is about 2%. So we have a 98% failure rate. And there really is not much research in that area other than giving statins and some of those drugs. So we're trying to do research that says, what are the things we really need to do to help you by getting back to the basics? Because we're finding, especially this ARC study has shown us, it is so important just to get back to the basics and take care of yourself. We're investigating a couple things. One is these agents that lower your cholesterol, like stanols and sterols, combined with fish oil, which we know can lower your chance of sudden cardiac death. Fish oil is the only food ever endorsed by the American Heart Association. It's the only pill I take every day, because about 1,000 milligrams of DHA and EPA, the two active ingredients that's on the side of the bottle in fish oil, will lower your chance of dying suddenly significantly. And it's a pretty low-risk thing. We're studying that. We're studying what types of things lead patients to change their behavior. We all tell patients things, and that's educating them, but we're not changing their behavior, which is a whole different kettle of fish. And that takes a lot of research to look into that. We're looking into your own body's stem cell response. We know that people that have a heart attack and start exercising after a heart attack have more stem cells, the cells that are the progenitors that can go to your heart and help grow new muscle. That the ones that are active and do exercise after heart attacks have a lot more of those cells than ones that aren't. So again, it's looking into the things you can do as a patient to really help yourself the most.